Hey there. This is the first of a group of videos designed to help you with the Board of Nursing rules and regs, our very last module um, in the semester. And the first thing to talk about is the mission of the Board of Nursing. Their mission is to protect the public from incompetent nurses, people who practice unsafely. They have a lot of things that they do this, and their mission is important. We want safe people out there practicing nursing. And and the 13 members that are on there that advise the board, that's a representative of all the different programs out there. The Nurse Practice Act is what gives the board the administrative power to regulate nursing. And there's a list here of functions that they do: regulate your practice, establish standards of practice, interpret the Nurse Practice Act and rules and regs for nursing education, license, and practice. They get the complaints and investigate possible violations of the Nurse Practice Act. They discipline the violators. They provide a place for the public to look at the rules and regs and make comments on it. They also provide a place for the public to be able to see if a nurse has a history of a problem in the past. Um, they do their licensure. They do license by endorsement. And like if you have a license in Georgia and you want to come to Texas, your primary residence is here, you can do a license by adjustment. By endorsement. Establish standards of nursing practice. They take care of the NCLEX. They take care of the nursing schools and the faculty. And they do whatever the Texas legislature mandates them to do. And one of the rules that they do have is who can use that license, a RN, and they're real particular about that. If your badge says RN, you need to be a RN, not somebody that is like a GN that hasn't taken the test yet. That's a piece that's important. When y'all graduate and your official title is a graduate nurse, then your badge can say GN. And if your employer wants to, save a little money and just go ahead and make you a badge that says RN before you actually pass your initial licensure exam, then this is the rule right here that you would be breaking that it could be a problem for you when you actually try to get your license. So be sure that, if you're an RN, it says RN, and if you're a GN, it says GN. And the if like a UAP or a LVN has nurse on their badge, then that is not something that can happen either. Help them out with that, because RNs are the only ones that should have nurse on the badge, because they feel like it would be misleading for a CNA or LVN to have on nurse, because most people think of that licensed registered professional nurse. Here's a piece right here that has misleading abbreviations like we talked about, RNGN. Your scope of practice is in here as an RN. You're using the nursing process to care for patients and manage their illness. The piece in here about distributing prescriptions drugs is more for advanced practice nurses. And of course, performing delegated acts by a physician is another piece in here, and development of the nursing care plan. So there's a piece of your nursing, what am I trying to say here? Scope of practice. There we go. That is right here listed for you. And then there's a packet that they have on here for delegation for you too. You know, when you delegate to other individuals that are in your chain or in your team, then there's a packet that the board has that's available for nurses to look at. That's a scope of practice right here in delegation practice. It's right in here in this delegation resource. Now, there's some practice exemptions, and I want to explain this. There's a lot of things that only RNs can do, like they're the ones that need to develop the plan of care. They're the ones that need to use nursing process to evaluate outcomes, those kind of things. But there are some things that individuals can do that don't have an RN license. And gratuitous just means free nursing care to a sick person that's provided by a friend. Nurses working in a disaster situation under a different state, under their emergency management plan. You know, they may not have an RN license in that state. Nursing care that is, you know, prayer or spiritual means that you don't need a license for that. Anything performed under the provision of a person by the Texas Medical Board, and you know, that could be your physician assistants, those kind of people doing acts that's under the supervision of a doctor. And then down here it says an act performed by a licensed another state agency if the act is authorized. So respiratory therapy can give breathing treatments, you know, physical therapy can do dressing changes. That was that one's talk about. The other thing in here is about your practice of nursing as a student. So, you know, you're doing nursing acts under the supervision of an RN, and you don't have a license. So there's another practice exemption. And then the last one listed on here is an RN license in another state who is in the state on a non-routine basis for 72 hours. And think of it this way, you know, when you have a license, a nursing practice license in California, you're going to bring a patient to Texas on an airplane and come over fixed wing and bring this patient to Texas, then that nurse is practicing nursing on a California license in the state of Texas. And the deal is they just have to be done and gone in less than 72 hours. This doesn't work for nurses who practice in home health care that go to different states that aren't in a compact, because home health care would be like a routine basis. That would be part of their job. So if a nurse lived in one state and routinely did home health care in a different state that was non-compact, then that individual would need to have a license in that other state. So here's your information, your link here for your scope of practice on the board website. And that is all for this video.